Hello everybody, my name is Dr. Kira. Surgery Squad just got updated with 3 new surgeries, and in no particular order, we're going to do those surgeries. They are tonsillectomy, teeth whitening, and teeth cleaning. All 3 of which I myself could benefit from. I think I still have my tonsils, actually. Anyway, so let's jump right on in with tonsillectomy first. Okay, so
Welcome to Surgery Squad's virtual tonsillectomy surgery. I'm Dr. Jeff.
Hey Jeff.
Today we'll be removing a young man's tonsils. This is a common operation that's performed when a patient suffers from frequent bouts of tonsillitis. It's most often performed on younger patients, but adults can need it as well. The tonsils are located at the back of your throat on either side of the uvula. That's the little punching bag thingy that hangs down in the middle. Tonsils are infection fighters, but occasionally they lose the fight and get infected themselves. They become red and enlarged and can sometimes make it hard to breathe and swallow. Normally we treat this with antibiotics, but when tonsillitis reoccurs frequently, we remove them because the infection can cause more serious damage. Our patient was given a sedative before being brought into the operating room, and the anesthesiologist will help put him completely under. Help me out and place a breathing tube in our patient's nose to assist with breathing while we operate.
So that's actually very interesting. So the tonsils are there to fight infection. I always thought that the tonsils were there for shits and giggles, kind of like the appendix. So get in there.
We need to get our patient's mouth open wide so we have room to work. To do that, we'll use a special mouth gag retractor that opens the mouth, depresses the tongue, and locks into position. Why don't you take a crack at that?
Okay, get in there.
Great job. That should give us plenty of room. Now we have to reach in and grab the
this thing's
infected
nasty,
tonsil
man.
with the tonsil forceps. We need to pull it to the side to expose the connective tissue. Can you do that for me?
Okay. Grab
Nicely
it.
done.
There we go.
With the tonsil extended out, we need to place this electrocautery device at the tonsil's base. The device uses high-frequency current to cut away tissue and seal off the blood vessels at the same time.
Okay.
By removing the tonsils this way, we reduce bleeding and allow the patient to heal faster. Now that the tonsil has been cauterized, we reach in with a tonsil guillotine clamp. The clamp severs the last of the connective tissue and allows us to remove the tonsil from the throat. Clamp the tonsil and pull it out, would you?
Okay, so there we go.
We'll bring the electrocautery device back in here and apply it to any bleeding areas.
Okay, get in there and in there.
Because this part of the throat heals quickly, we won't need any stitches. Now we repeat our steps on the other side of the throat. Extend the other tonsil with the tonsil forceps.
Okay.
Just like the other side, we'll cauterize this tonsil to release it.
Alright. Heal up, or cut, burn that out.
And finally, we need to remove the tonsil.
Huh. This tonsillectomy is a lot simpler than I thought it would be. I always, because as I said, I'm pretty sure I still have mine. And I thought, well, I don't know what the hell I thought really. Because I never knew how they did this. And I'm learning a lot with this shit, guys.
And don't forget those bleeders.
Alright.
I'll clean out the mouth with some irrigation and suction, and then we're all done.
So basically you're using some water.
We'll send our patient to recovery for 8 to 10 hours, and more than likely he'll be able to go home later today. Once he's sent home, our patient will be put on a course of antibiotics. He'll need to keep hydrated with cold water or sports drinks. And if he gets hungry, he can have cool, soft foods like fruit pops, gelatin, sherbet, pudding, and of course, ice cream. Getting a little hungry?
Yeah, actually I am.
Thanks for stopping by SurgerySquad.com. While you're here, check out some of my other spectacular surgeries. They'll always stand the test of time, unlike my hairline.
Okay, so that was tonsillectomy, and as I said, that was a lot simpler than I thought it was going to be. I expected like this grand major procedure, kind of like what the root canal was, you know? So give me 1 minute. I will pause the video here, and then I'll jump over to either teeth whitening or teeth cleaning, and then Dr. Kira will be right back. Okay, everybody, we're back with teeth whitening surgery. So as always, let's jump right on in. Oh, and I actually asked, I did not have a tonsillectomy. There we go.
Hello, and welcome to Surgery Squad's virtual teeth whitening. I'm Dr. Susie, and
Hey, Susie.
I'll be guiding you through this procedure today.
Okay, let's do it.
You no longer have to be a supermodel or a movie star to have a dazzling white smile. Just about anyone nowadays can get one. A whiter smile looks healthy, plus it can improve your overall appearance and self-confidence. Our teeth become stained from coffee, tea, and other dark-colored liquids, and smoking certainly adds to the discoloration.
You didn't see anything.
Remove those stains caused by age and the things that we eat and drink. There are a variety of ways to do it. A whitening toothpaste or rinse, over-the-counter strips and gels, tray-based whiteners, or in-office whitening performed by a dentist. While the most obvious benefit is a brighter, whiter smile, you do know that whitening is not permanent.
Do you guys read that?
Program,
the woman
whether
used
you do it
piss
yourself
and
or
goat
have it
milk
done by a dentist,
for
might not always lead
teeth
to the
whitening.
results you want. If you have the whitening performed by a dentist, your teeth need to be in pretty good condition. Your dentist will also want to fill any cavities or replace older fillings before the procedure. In addition, a dentist will not perform the procedure if you have gum disease or your teeth have worn enamel. If you already have crowns or other restorations, the whitening will be inconsistent between those teeth and the others. Our patient today is a 27-year-old woman who has opted for an in-office dental whitening. She's a tremendous admirer of coffee, but she wants to impress the folks at her 10-year class reunion with a bright, white smile. So let's scrub up, glove up, and help her out.
No, but
Our
seriously.
hygienist has already cleaned her teeth to remove all of the plaque. So let's start by matching our patient's current tooth shade with one from our shade reference guide.
Now, as I was saying, did you guys read that? The ancient Romans used piss and goat milk to do this. Ew.
Okay, we've got our starting shade. Let's see if we can make them more like this. First, protect her lips and tongue by covering them with these rubber guards.
Okay.
Nice work. Now we need to cover her gums and papilla, which are the tips of her gums between her teeth, with a special coating to protect them from the risk of chemical burns when we use the bleaching agent. Now, let's mix up our bleaching agent. We'll use carbamide peroxide, which is a powerful, reddish-looking substance. It turns into a stronger form of hydrogen peroxide in the mouth once we clean it off with water. That's when it takes off the stains. The mixture is ready, so let's get it onto her teeth. Cover each tooth evenly.
Okay. The hell kind of sound is that? Okay, give me 1 second, guys. I'm going to be here a little while.
Let's see what kind of beautiful smiles underneath all of this red stuff. Take some water and gently wash away the carbamide peroxide.
Okay. Alrighty then. This shit can't be comfy though, guys. I mean, you're basically sticking some kind of like gummy crap all over your teeth. Okay, here we go. Okay, come on. There we go, there we go, there we go, there we go, there we go. Alrighty then. Okay, almost there, almost there, almost there. Okay, and the top row is done, ladies and gentlemen. Now we gotta wash off the bottom row. There we go. Yeah, I'm actually learning a lot from this sketch. I didn't think I would, you know? Okay. And we are just about done.
Now with our dental pick, simply pop the protective coating from her gums.
Okay. Okay. Okay, get out of there. There we go, okay.
Great work! I'll take off the rubber lip and tongue protectors and see you back out in the waiting room. She's really gonna knock 'em dead with that bright smile of hers at her class reunion. But for now, her teeth will probably be sensitive for a few days. She should avoid extremely hot or cold beverages for the rest of the day and use a toothpaste made for sensitive teeth for a couple of weeks. She should also, as much as possible, avoid discoloring beverages like coffee, colas, or red wine for a few days. If she smokes, well, now would be a perfect time to stop.
Yep.
This bleaching will most likely last for 2 or 3 years, so she'll want to make this an ongoing part of her overall dental care.
Yep.
She should call her dentist if she feels a burning sensation in her gums or on her teeth that lasts for a couple of days, or if her teeth remain highly sensitive. You did a fantastic job today. While you're here, try your hand at one of our other surgeries available at surgerysquad.com.
Okay, everybody. Now, what the... Okay, we're gonna do these ones, this one here in a later video. The lumpectomy surgery. Okay, we're gonna do that one for a later video. For now, we're gonna move on to teeth cleaning. So, give me 1 minute. I will be right back. So, don't go anywhere. Okay, guys, time for a tooth cleaning. As soon as it loads. As soon as it loads. As soon as it loads. Thank you. Shut up, clock.
Welcome to Surgery Squad's virtual dental prophylaxis. I'm Dr. Jeff, and I'll be assisting you with this procedure today. Dental prophylaxis, commonly known as a teeth cleaning, is a critical procedure in which a dental hygienist not only removes plaque and powder from your teeth, but they can also instruct and demonstrate proper oral hygiene care. It is recommended that everyone get their teeth cleaned at least once every 6 months. If you're at a higher risk for periodontal disease due to age, tobacco use, or medical conditions such as diabetes or HIV, it is recommended that you have your teeth cleaned more often. Our patient today hasn't had a teeth cleaning in nearly a year, so they're certainly due for one. Let's put on our gloves and get started. Before we begin, would you like to learn about some common myths and misconceptions regarding general oral health?
Please. Now, as I was trying to say, before Jeffy here cut me off, I was not aware that HIV could affect the teeth. I knew it affected, like the blood. Kira, shut the hell up. This is a comment war that we're about to start. Don't say anything more. Just click sure.
Great. Click on the following statements to learn about that myth or misconception.
Okay.
Even though temporary teeth are eventually replaced, it is still recommended that they are brushed and flossed daily. Daily brushing and flossing not only prevents cavities and tooth decay, but it also helps children establish good oral hygiene habits.
Hard bristled toothbrushes work better than softer bristles.
Most dentists and dental hygienists will recommend that you use a soft bristled toothbrush as they get your teeth clean without damaging your teeth and gums. Hard bristled toothbrushes can cause your gums to recede.
Okay, is that bad? It's a good idea to stop brushing or flossing if your gums begin to bleed.
If your gums bleed when brushing or flossing your teeth, it's a sign that your gums aren't healthy. It's recommended that you see your dentist if you experience bleeding gums. Brushing and flossing every day, in combination with routine teeth cleanings, will keep your gums healthy and prevent future bleeding.
Brushing alone is good enough to keep your teeth healthy and clean.
While brushing does help keep your teeth and gums healthy, it is recommended that you floss at least once a day as well. Flossing removes the tiny pieces of food and plaque trapped between your teeth that your toothbrush can't get to. Recent studies have also shown that flossing reduces the risk of heart disease.
Okay. A pregnant woman should avoid going to the dentist.
While it's recommended that pregnant women avoid getting x-rays, they should not avoid going to the dentist. The dental health of a pregnant woman has a serious impact on the health of her unborn baby.
Really?
Dental infections or diseases during pregnancy could increase the chances of a baby being born prematurely and underweight.
I didn't know that. Interesting. Okay, begin the procedure,
Let's
Jeff.
get started.
Okay.
You'll need to measure the depth of the periodontal pockets around each tooth using a periodontal probe. The probe is inserted with light pressure between the tooth and gum. When the probe is inserted, it will result in obscuring a section of the periodontal probe's tip. The first marking visible above the pocket indicates the measurement of the pocket depth. Measurements of 1, 2, or 3 millimeters generally signify that our patient's gums are in good health. But measurements of 4 millimeters or more indicate the presence of periodontal disease. Why don't you go ahead and use the probe to measure the depth of our patient's periodontal pockets? As you probe, I'll call out the measurements.
Okay, get in there.
3, 1, 2, 2,
Okay, we're going to get an unhealthy one?
1, 4.
Uh-oh.
Great job. I'll take it from here. 3, 1, 2. Based on the measurements, our patient could stand to floss a bit more regularly, but other than that, it appears that their gums are in good health. Now we need to remove the dental plaque and tartar on both the surface and below the gum line using a scaler.
Okay. Ugh. God, dude. It's the sounds, man. That's what I never liked about this game, this website. The sounds alone are just fucking cringeworthy as all hell. Okay.
These choppers are looking great.
But
Next, we'll use our toothpaste to polish our patient's teeth. Toothpaste, known as prophylaxis paste to dentists, is a gritty substance that is applied using an angled attachment. This attachment is inserted into our handpiece. Which flavor of paste does our patient want?
let's go with the green.
Mint, my personal favorite.
Okay then. Ah!
Wow, that's fresh smelling. Now we'll use the water from our Aaah water syringe to wash off the paste.
Okay. Come on. There we go. Okay, there we go.
Don't forget the suction.
Okay. Get in there.
And finally, we'll need to floss the patient's teeth.
Okay, get in there. Well, at least now I know what to look forward to when if I decide to go for a tooth cleaning. Ay, ay, ay. Thunk. Okay.
Perfect. Their teeth haven't looked better. We all know that we need to regularly brush and floss to keep our teeth and gums healthy. But what else can we do? Well, get a new toothbrush or change the head of your electric toothbrush at least once every 3 months. Over time, your toothbrush collects bacteria, and the longer you hang on to it, the more bacteria you're putting into your mouth. Obviously, you want to avoid foods and drinks that are high in sugar, but you also want to make sure you're not leaving out those that are high in calcium, vitamin C, and vitamin D. Foods such as apples, celery, raw carrots, and even popcorn can also help clean your teeth. So if you can't brush after a meal, eat an apple. Your teeth will thank you. Looking to keep your breath clean? Make sure you pick up the alcohol-free mouthwash. Mouthwashes that contain alcohol can dry out the tissues in your mouth, causing them to become more vulnerable to bacteria. By cleaning your tongue with a tongue scraper, you're eliminating plaque and the pesky bacteria that can cause bad breath. As stated before, you should schedule a teeth cleaning at least once every 6 months. This not only helps keep your teeth and gums healthy, but your dental hygienist can help you reinforce good oral hygiene habits. These are just a few tips to help you maintain good dental health. Remember, keeping your teeth healthy is just as important as keeping the rest of you healthy. And that's a dental cleaning. Fantastic job! Let's see what else you can do on SurgerySquad.com.
So that was tonsillectomy, tooth cleaning, and whitening. Now, I'm actually learning a lot from this series, you guys. And I'm having a lot of fun while I'm doing it. I didn't think I would, to be honest with you. I thought, when I first started this series, I thought, okay, this is going to be boring. This is going to suck. This is going to be like Surgeon Simulator, basically. But no, I'm actually learning a lot, guys. I'm surprised at that fact. So, yeah. Anyway, that was Surgery Squad. If you like this video, slap that like button in the face, and as always, I will see you in the next video. Bye-bye!